Research at Fox is really focused on its mission. So the part of the mission is excellence and innovation. And the research focus gives students a chance to really kind of push the envelope in terms of what does it mean to be cutting edge clinical practice. They get to wrestle with that and kind of expand care and kind of discuss like what it means to really change the way we're currently treating patients.
The program is built around research, whether it's in the biomechanics lab or out in the community. We want to use research to bring evidence-based practice to the clinics.
How to read it, how to interpret it, how to perform it, so you really know the ins and outs of what you're looking for, I think sets you ahead of a lot of other people out there. I think it's really unique here, and one of the things I really liked about George Fox and why I chose to come here was the students here actually participate in research projects that consist of like 1 or 2 year long projects, and have the opportunity to participate in other research as well.
We've been focusing in on traits that are specific to physical therapy and allowing physical therapists to measure psychosocial domains that they've never really measured before. And so those are really specific measurements, and it's kind of led to us developing curriculum and student experiences where what they're doing is experimenting with these new kind of social domains of health with patients, in addition to having a strong biomedical background. And so that kind of links them in kind of a holistic kind of approach to patient care, basically.
What we want to do is be able to empower our patients. We want to be able to educate them on best practice. We want to address the patient as a whole person rather than just their injury or their diagnosis themselves.
We got to participate in these research projects where you're in groups of like 4 to 6 or so with a faculty mentor that is kind of guiding that project and helping you along the way so that you're learning all the ins and outs of what to do correctly.
We do a research symposium. We've done literature research, we've done testing on participants, and this is where we get to show the data that we found. Being able to do it as a group, having it as a class that's required, and us having meetings with professors, it really brings it into a community group effort, because we're going to have to work in a team when we're going out in a clinic. We're going to have to find solutions when we're out there with our teams.
So one thing that really I think makes our students unique is we want them to explore innovation, leadership, and excellence, and all those things kind of go together. Like if you have to define excellence, it's when people follow you because you're doing a job that's above and beyond. So our goal is to define, give the students techniques and innovation practices that puts them, in a position where other practicing clinicians want to follow them because they have new ideas and approaches to both community health, individual, excellence in patient care, and then kind of biomedical or biomechanical approaches to, special patient problems.
And I think it's a great way George Fox has implemented their pillar of research, but also their pillar of community service, because they're tackling the research side, but also they're opening up this symposium for other physical therapists out in the field to come and learn about these new techniques or new truths that are coming out that they can be incorporating into their PT practice in order to give the highest value evidence-based care that they can.
When we leave here, it's our responsibility to stay up to date with the research. It's our responsibility as therapists, to provide evidence-based practice and patient-centered care. What was done 10 years ago doesn't mean it's helping now. So we want to make sure we're providing the best care for our patients, and that can be seen through the research. That can be seen through other therapists who have done other experiments, or they've gone above and beyond to say, hey, this works now. We have clinical practice guidelines. It's that's the golden rule for different diagnoses. If you're a therapist, it's important to be able to provide the best care.
The one thing that really stands out to me and strikes me is just their excellence in care. They harp so much on providing meaningful, high-value, patient-centered, evidence-based care that's going to actually impact the patient. And one thing we talk about is you got to be better than regression to the mean. Whereas here, we're all about how can we empower you as a patient to take control of your own health care and get better so that you don't have to keep coming to see us, and that you can live your life how you want to live it and not be held down by your injury.